So operational efficiency, patient volume increase with same staffing levels of AI-enabled clinics. Let me explain this a little bit better. Increase with same staffing levels, operational efficiency. One of the statistics we had when we were actually analyzing, we were using Canadian Bureau of Labor statistics that there's already studies out there that say how much time a physician spends, like of every hour that he spends in patient care, like what percentage of that hour is spent in direct patient care, writing notes, writing prescriptions. This already exists for studies. So we took that information and then we multiplied it by the degrees of efficiency that we brought down some things. For example, it's very hard to tell people this is exactly how much it would help because there is tremendous amount of variability in healthcare from a patient to the next, unless you work in an extremely narrow service. So like we only do one thing. Like for example, in Quebec, we have something called winter clinics where they basically they see you for sinusitis, pharyngitis, all these upper URI type symptoms, bronchitis, all these things that happen typically in winter months, it gets worse. So the government created these clinics called winter clinics. If you have a winter clinic, it's easier to measure these things. But when you have a patient that comes in for depression, another one comes in for a follow-up of ADHD, another one comes in for a UTI, then another one comes in for a workers' comp, the time is very different from a case to the next. Different complexity requires more or less work. Patient volume, what is it referred to? So let's say you make, like I discussed earlier, if you work 8 hours a day, and what we have from some studies with AI scribes, I'm not talking about my technology. By the way, my technology is not even mine. It's put together by me, but it's using LLaMA. I use LLaMA, but I've used Opus, I've used ChatGPT, I've used DeepSeek, I've used pretty much every language model that I tried out there that you can have access to. These language models do the work. There's something doing the work for you behind all that. Now, the good thing is that some of these models are open source. So the government could extremely easily have an open source model and run the entire thing there and pay no AI fees to anybody. Do you understand how this is absolutely insane? A simple MacBook, this computer you see here, MacBook Pro, that's maybe 3,000 Canadian dollars, can do like 200 consultations an hour. 200 consultations an hour. The average physician is like struggling by having more than 6 patients an hour. This can do 200. So we can have like 6 doctors, 8 doctors, easy. Everything done for them through an AI. The AI is installed in the computer on a private server. So this is where we're going to, okay? Operational efficiency. Definitely. So in a previous conversation I had today, or a presentation, I said that we had a study that said that the average time that a physician takes is 16 minutes for a note. It gets narrowed down to 3 minutes when you get an AI scribe. It was 13 minutes per case, 25 cases a day. We said it was about 70% of your time as a doctor is being instantaneously overnight solved and done for you instantaneously. This is not normal, like it's not the normal evolution of medicine. I earlier spoke about buying a stethoscope from EcoHealth that costs $500. That's a simple evolution. We're talking about operational evolution. This 17% patient volume is a fallacy. It's not accurate. So we have multiple studies saying all these things. The truth is that it's not even reasonably quantifiable. It's not reasonably quantifiable. What will reflect is your practice. When you start using these technologies and you see how your practice is like significantly better, you're going to see what I mean. It's the way to go into the future. Combine impact across healthcare, revenue optimization, improved ROI, enhanced productivity. It's all the same. It does the work for you. AI does your work for you. What can you trust it with is the first question. What can you do for me that's reliable? So this is where you either see it, you have to see a demo, or you look at technologies yourself and you can build it yourself through things like My GPTs, which is another method that you could use. You combine different tools. You should see my video on the different tiers of automation for medical practice. So you understand you different tiers of AI automation together, different tiers of automation of which AI is a tool within the different tools. You bring them together and then you have pretty much 90% of your work done for you. That's how it works. Key takeaways, immediate ROI. This is one of the most impressive things. When you're a builder like me, programmer, physician, AI enthusiast, and you start working with these technologies, you hit these walls that you could spend 10 hours trying to fix. When you fix that problem, it's like night and day. The evolution in AI technology and programming is beyond the realm of human capacity because we're using AI to program AI. So AI is becoming ever better and more efficient at doing complex things from simple commands. So this is how you do it. Staff optimization. One of the biggest issues I had and that I wanted to correct in my medical practice was dependency. I want to have a simple medical practice that doesn't make me dependent on having a nurse, having a secretary and all these things. As much as possible, I want to have a simple practice that allows me to do what I like. So staff optimization. What happens if and this happened to me in the past where I had a secretary, she gets sick. Man, people get sick. She calls off. I have 20 patients scheduled. So what happens now? There's only me and my secretary. You know what happens? Bad things happen. So now I have to either double as a secretary, or I have to start asking people for favors. If I don't hire people consistently, who's going to come for one day on an emergency basis call to do all the things that they need to do at my clinic, not knowing how my clinic operates? It's a nightmare. So simple things for solo practice physicians are definitely better. And I love using Spruce. And that's why I love the asynchronous model, because it's more efficient and it's more physician friendly. Will give you not only independence, but you can also have communication wherein your secretaries are also on the application and they interact with your patients, or both of you interact with patients through the chatting system. Revenue cycle, AI billing solutions, future ready early adopters gain competitive financial advantage.